A comprehensive grasp of CPT procedure codes enhances the quality of patient care, streamlines administrative processes, and contributes to the overall efficiency and effectiveness of healthcare delivery. Welcome back to my YouTube channel. If you are new to my channel, welcome to Medicare Inside. Hi, I am Nishaba, a certified medical coder. In this video, we will explore the procedure codes of shoulder, axilla, upper arm, elbow, forearm, wrist, and hand. Embark with us on the journey of code exploration. Shoulder and axilla, the next anatomical site of CPT anesthesia. The axilla or armpit is an anatomical region under the shoulder joint where the arm connects to the shoulder. The shoulder and axilla includes humeral head and neck, sternoclavicle joint, acromioclavicle joint, and shoulder joint. The humerus bone is located in the upper arm between the shoulder joint and elbow joint. It is the largest bone of the upper extremity. Sternoclavicle joint is the link between the clavicle or collarbone and the sternum or breastbone. The acromioclavicle joint is the joint in the shoulder between the collarbone or clavicle and scapula. First code is 01610. Anesthesia for all procedure on nerves, muscles, tendon, fascia, and brucei of shoulder and axilla. Next code is 01620. Anesthesia for all close procedure on humeral head and neck, sternoclavicular joint, acromioclavicular joint, and shoulder joint. Next code is 01622. Anesthesia for diagnostic orthoscopic procedures of shoulder joint. Next code is 01630. Anesthesia for open or surgical orthoscopic procedure on humeral head and neck, sternoclavicle joint, acromioclavicle joint, and shoulder joint, not otherwise specified. Next code is 01634. Shoulder disarticulation. Next code is 01636. Interthoracoscapular four-quarter amputation. Interthoracoscapular four-quarter amputation is a surgical procedure that involves the removal of entire arm, including the scapula and clavicle, as well as the portion of the chest wall to treat advanced cancers or traumatic injuries involving the shoulder and upper extremity. Next code is 01638, total shoulder replacement. Next code is 01650, anesthesia for procedures on arteries of shoulder and axilla, not otherwise specified. Next code is 01652, axillary brachial aneurysm. The axilla or armpit is the anatomical region under the shoulder joint where the arm connects to the shoulder. The term brachial refers to anything related to the arm, especially the upper arm. An aneurysm is the abnormal swelling or bulging in the wall of the blood vessels such as artery. An axillary brachial aneurysm refers to an abnormal dilation or bulging of the blood vessel in the axillary, armpit, and brachial upper arm region. Next code is 01654, bypass graft. The provider performs anesthesia services for a patient undergoing a bypass graft procedure for the arteries of the shoulder and axilla. Next code is 01656, axillary femoral bypass graft. Axillary artery is the main artery of the upper extremity. The femoral artery is the artery in the thigh. The provider performs anesthesia service for a patient undergoing a bypass graft procedure from the axillary artery to the femoral artery. Next code is 01670, anesthesia for all procedure on veins of shoulder and axilla. Next code is 01680, anesthesia for shoulder cast application, removal or repair, not otherwise specified. Upper arm and elbow, the next anatomical site of CPT anesthesia. First code is 01710. Anesthesia for procedure on nerves, muscles, tendons, fascia, and brucei of upper arm and elbow, not otherwise specified. Next code is 01712. Tenotomy, elbow to shoulder open. Tendons connect muscles to bones. Tenotomy means releasing tendon to relieve pain. Next code is 01714. Tenoplasty, elbow to shoulder. Tenoplasty means plastic surgery performed on the tendon. Next code is 01716. Tenodesis, rupture of long tendon of bicep. Bicep tenodesis is an orthopedic surgery performed to repair the tendon that connect bicep muscles to the shoulder. Next code is 01730. Anesthesia for all close procedure on humerus and elbow. Next code is 01732. Anesthesia for diagnostic arthroscopic procedure of elbow joint. Next code is 01740. Anesthesia for open or surgical arthroscopic procedure of the elbow, not otherwise specified. Next code is 01742. Osteotomy of humerus. It means the provider perform anesthesia service for a patient undergoing osteotomy of the humerus, which is the long bone within the arm. An osteotomy is a surgery that cuts or reshapes bones. Next code is 01744. Repair of non-union or malunion of humerus. Non-union is the failure of fractured bone to heal or mend after an extended period of time. Malunion refers to a fracture that has healed in deformed position or with shortening or rotation of the limb. Next code is 01756. Radical procedures. It means the provider perform anesthesia service for a patient undergoing a radical surgical procedure on the elbow through the arthroscopy or open approach. Next code is 01758. Excision of cyst or tumor of humerus. Excision means removal. Next code is 01760. Total elbow replacement. Elbow replacement involves surgically replacing bones that make up elbow joint with artificial elbow joint parts. Next code is 01770. Anesthesia for procedures on arteries of upper arm and elbow, not otherwise specified. Next code is 01772. Embolectomy. Embolectomy are performed to remove blood clots or foreign bodies from blood vessels. Next code is 01780. Anesthesia for procedures on vein of upper arm and elbow, not otherwise specified. Next code is 01782. Blepharophy. Blepharo means vein. Raphy means surgical suturing. The provider perform anesthesia service for a patient undergoing suturing of veins of upper arm and elbow. Forearm, wrist, and hand, the next anatomical site of CPT anesthesia. First code is 01810. Anesthesia for all procedure on nerves, muscle, tendon, fascia, and brucei of forearm, wrist, and hand. Next code is 01820. Anesthesia for all close procedures on radius, ulnar, wrist, or hand bones. Radius and ulna are two bones of the forearm. Ulna is located on the pinky side and the radius is located on the thumb side of the wrist and runs parallel to the ulna. Next code is 01829. Anesthesia for diagnostic arthroscopic procedures on the wrist. Next code is 01830. Anesthesia for open or surgical orthoscopic endoscopic procedure on distal radius, distal ulna, wrist or hand joint, not otherwise specified. The part of the radius connected to the wrist joint is called the distal joint. The lower end of the ulna form the part of the wrist joint. Next code is 01832, total wrist replacement. Next code is 01840, anesthesia for procedures on arteries of forearm, wrist and hand not otherwise specified. Next code is 01842, amblectomy. Next code is 01844, anesthesia for vascular shunt or shunt revision, any type, for example, dialysis. Shunt is a passage or tube that is made to allow blood or other liquid to move from one part of the body to another. Vascular shunting is the process of redistribution of blood. Next code is 01850, anesthesia for procedures on vein of forearm, wrist and hand not otherwise specified. Next code is 01852, phlebotomy. Next code is 01860, anesthesia for forearm, wrist or hand cast application, removal or repair. If you have any question or need further clarification, feel free to ask in the comment section or reach out via email. Thank you for watching. If you enjoyed the video, please like, share it. Your support means a lot to me. If you haven't already, consider subscribing for more. Click the bell icon to receive notifications. For more detailed guidelines, CPC mock or exam related questions and notes, email me at my given email ID.